The greatest public health crisis of our lifetime, of course, this COVID-19 pandemic, is spotlighting another possible challenge.
ABC 6 News reporter Rachel Mills is live with us in the studio tonight talking about why some health officials claim there are racial disparities in vaccine distribution. Rachel.
Ross and Laura, CDC data shows the United States has widespread disparities in access to health care when it comes to race. And now Minnesota health leaders say the COVID-19 pandemic and vaccination efforts are highlighting this inequality here.
There's that saying, what gets measured gets done. And so having the data lets us know, are we achieving our goals?
The Minnesota Department of Health now has a new online dashboard showing race and ethnicity numbers for vaccinations in the state, and the disparities are clear. White is the only race category meeting and actually exceeding its population percentage for vaccinations. The question is why.
We are at a 95% white in our 65 plus population. So there have been, I think, some challenges just with the populations that have been targeted for vaccination.
This is true. Most people over 65 in the state are white, so it makes sense more will get the vaccine. But among people of color over 65, the percentages, they say, are still below those of the white population. And there's a reason for it. Some of it has to do with fear.
For our populations of focus, that many of them have experienced and continue to experience, trauma related to medical testing, to procedures, to treatments. And so they are more reluctant to be vaccinated.
State health leaders are now proposing that communities of color were more drastically affected by COVID-19 from the start. So now it would be fair to somehow get more vaccines available to them.
We have evidence of systemic racism in our country and in our state, and that has led to social conditions that make it more difficult for some populations to be healthy.
So here's what the state is planning to do.
We will be expanding vaccine distribution to more community clinics and directing more doses to more community pharmacies located in communities in particular need of additional vaccination attention.
The state will also be using more diverse media outlets and empowering community leaders to urge people of color to get vaccinated. MDH also mentioned deploying mobile vaccine stations into these communities so they can be vaccinated in a comfortable setting.
We care deeply about ensuring that each and every Minnesotan in every community from every walk of life has fair and equitable access to the vaccine.
MDH will continue collecting data from individual providers and the Vaccine Connector tool going forward. The state will also be updating their race and ethnicity dashboard weekly as vaccine eligibility expands.